So with Crohn's disease, I think the first important factor is that symptoms do not correlate with what's going on inside. And what I mean by that is how you feel might not be the same as how it looks inside during a colonoscopy. So if we take a look inside and we see a lot of inflammation, that person might feel great and have no symptoms at all. And some people that we know have Crohn's disease could feel very sick, and I can look inside and it doesn't look so bad. So common symptoms of Crohn's disease includes abdominal pain, frequent bowel movements and diarrhea, weight loss, could have fevers, their belly could get bigger or distended. Some patients uncommonly may develop an abscess or swelling in their anal area that they might not relate to Crohn's disease. Other common symptoms patients get are joint pains, so pain or swelling in their knees, their elbows or ankles. They could develop different types of skin rashes. They could commonly develop eye pain where their eye gets red, or they could develop sores in their mouth. And it's not uncommon, I see somebody 2-3 years later with maybe some mild abdominal pain. They're in college, they think they're eating unhealthy and they're out drinking, and they might have a little bit of pain and diarrhea and they don't think much of it, but they also been having knee pain and can't run as much as they used to, or they develop recurrent mouth sores or skin rashes. And these are early signs of Crohn's disease. So it's important when talking to a physician, whether you have Crohn's or you think you may have Crohn's, to talk about every symptom you're feeling, not just what's related to your intestines and stomach. When symptoms worsen, it could be Crohn's flare, so more inflammation on the inside, or it could be from a stomach bug or stomach infection. It could be something called bacterial overgrowth or a change in gut bacteria. There's a significant amount of patients that have both Crohn's disease and irritable bowel syndrome. So maybe their irritable bowel syndrome is worse and they have worsening cramping. So if symptoms do worsen, it's important to communicate with the provider so then they can better help figure out what's driving those symptoms. Is it Crohn's or is it something else? I wouldn't recommend rushing to taking something over the counter or adjusting or increasing medications without getting a better sense on what's causing the symptoms.